Welcome to Your Infinite Health. Are you getting older?
Are you feeling it?
How would you like to do that in reverse?
We're your host,
Dr. Tripp
and Lene.
We've run an integrative medicine practice for 13 years.
Together, we have 60 years of combined experience helping clients.
We've helped tens of thousands achieve success in health and live longer, happier lives.
In this show, we'll cover peer-reviewed and evidence-based integrative approaches to creating the health you've always wanted.
We also share professional experience we see in the field every day.
So if you're ready to feel, look, and live your best life, you're in the right place.
Welcome to Your Infinite Health podcast.
Hey, Trip.
Hey, Lene.
How's it going?
Well.
Did you have a good week?
Had a good week.
Yeah. It's awfully rainy today.
Yeah, great day to sit inside and do.
A great day to do nothing,
Yes.
but that's, a great day to sit in and do podcasting. So we're doing something this afternoon, and I hope this weather doesn't jack up the travel arrangements
Right.
for the addition to the Goolsby family.
Right.
So we're getting a Sheltie puppy, and her name shall be Harlow Bizou.
Harlow Bizou.
Yeah. So kind of sprung it on the kids last night, but we've been waiting on this puppy for a while, right?
Oh, yeah.
She's coming all the way from Washington State, from
Spokane area.
Spokane, but like north, right? North of?
Yeah.
We were going to go get her. We're like, we'll just drive there. And the breeder's like, I don't know are you sure? And then we started pricing it out. And then we're like, yeah, maybe not. Maybe just fly her here. So she's coming from Asgard Shelties from Washington, and we'll be picking her up this afternoon. So pretty exciting.
Yeah. Looking forward to it.
So we've accumulated. We also recently got a cat, which we've never had a cat before. Is our youngest son's cat, and he named him Cinder. But I don't know why, but I always just want to call him Crisper. I have to catch myself.
I wonder why.
I don't know. So now we'll have 2 Shelties, 1 Silky Terrorist, a cat named Cinder, and it's a house full of animals. So we're heading into the holidays, and of course I have to have a holiday joke. Are you ready?
I guess.
Where'd it go? How does a gingerbread man get around with a broken leg?
I don't know.
With a candy cane.
With a candy cane.
Dun-dun-dun. Oh, I just dropped my phone. Sorry, guys. Okay, well, enough shenanigans. Let's get into today's topic, which I wanted to bring up. It's about testosterone and some sort of information that's floating around about testosterone and high blood pressure.
Yeah, I think we had a recent case for a patient of ours who had hypoxic or anoxic brain injury and is getting exosome therapy, but his brain injury resulted from an overdose of methamphetamine and
Don't do meth.
And a number of other recreational pharmaceuticals.
He mixed. It was meth mixed.
It was a complicated regimen, apparently. So he survived the initial insult, but has multiple sequelae from the period of anoxia, and his family is investing in exosome therapy for that. But he's recovered significantly at this point. And
how long have you been treating him?
We've been treating for about a year now. So
how did he present when he first engaged you?
Well, he was non-communicative, and all the communication was done through his mother, and he was mobile and had some use of his extremities, but now he's ambulatory again and has improved. He is communicative and actually manifests a sense of humor. His improvement has been significant, and not that I think the exosomes has certainly helped in that recovery. We don't know, obviously not having any formal studies or anything, but we know the regenerative capability of the exosomes for the brain are significant, at least in the animal models and in certain human trials. So the family is invested in, and he's reaping those benefits from his unfortunate accident.
Well, but you're not just it's not just exosome therapy. You're doing other things.
Right. We're doing the optimization and there are a number of other contributory therapeutics, ongoing biological therapeutics going on. But at the same time, it's very gratifying to see the outcome that's occurring. Yeah, but one of his issues apparently was he had attention deficit disorder and was on um, Adderall or Vyvanse for a while, and then Adderall as a child, and then into young adulthood. He's in his early 20s at this point in time, uh, and was the family has put him back on his other treating psychiatrist has put him back on Adderall.
Like now?
Yeah.
When he's been non-communicative?
Well, yeah, and his
And immobile?
well, no, he's more mobile. No,
Like he can't talk and he can't move, and they put him back on.
no.
Okay.
No, he's improved to the point where those were felt to be by his treating psychiatrist were felt to be beneficial.
Are joint pain and stiffness slowing you down? At Infinite Health Integrative Medicine Center, we specialize in regenerative medicine therapies designed to actually repair and restore without surgery, without months of downtime, and without a lifetime of pain medications. Our patients are getting back to the activities they love: walking, running, even playing pickleball, pain-free. Ready to discover what's possible for you? Schedule your free discovery call today at yourinfinitehealth.com. That's yourinfinitehealth.com. At Infinite Health, we are redefining what aging means.
In any event, so we've run into an issue here recently because part of his optimization process, he was hypogonadic. Testosterone level was below the normal range, even for even for an elderly adult, and so part of his treatment has been optimization of his testosterone levels and his other hormone levels. And more recently, as they have increased the dose of Adderall, uh, his blood pressure has now become a problem again. And it seemed fairly evident to me that it might be the sympathetic nervous system stimulation that was doing that, as Adderall is known to do that. But the mother was concerned that it was the testosterone causing the high blood pressure.
Why did she make that assumption?
Well, I think the old on testosterone included a possibility of aggravation of blood pressure. And so that's piqued my interest because testosterone is a cardioprotective agent and more often and as a vasodilator. So I was curious to see if there was any data to tell us that there was risk of hypertension or blood pressure issues in these individuals taking testosterone, particularly in hypogonadic men or in optimization. Now, for the optimization, there's optimization of testosterone has there's no good data that I could find. But more recently, about a year and a half ago, there was a large trial published in New England Journal of Medicine for replacement therapy for men who were hypogonadic with the transdermal approach with testosterone, which has garnered a lot of information for that modality. And it's interesting to note that in that trial, they followed the blood pressure to assess whether or not that it's going to be hypertensive because the trial was geared to follow up and see if there were any complications related to cardiovascular demise or strokes or cardiovascular disease overall. And so they were following the blood pressure quite closely. And in that trial, which I think was about 5,000 men, but that trial garnered information that in the treated, and those men that were treated, there was a 0.3 millimeter of mercury increase in blood pressure in those men receiving the testosterone. So 0.3 millimeters is not even a point on the blood pressure scale. So that realistically, on that trial, they did not document any complications related to increasing blood pressure. Likewise, that trial demonstrated that there was no increase in heart attacks or strokes. So that being said, the cardiovascular safety recommendations were revised by the FDA and resulted in a change in the recommendations and precautions from the FDA over the last year or so. So really interesting information. So obviously, my initial thought that the Adderall was the culprit in this increasing blood pressure issue with our patient is probably correct. But I did take a look and see if there was any information on the combined use of testosterone and sympathetic mimetics in individuals with neuropsychiatric disorders. And there have been no specific trials to address it, but the conclusion that I could draw from the information that I researched showed that realistically, it's unlikely that doing optimization therapy or replacement therapy with testosterone are cause to worry about blood pressure issues. So maybe following the blood pressure and making sure that everything stays in a normal range.
Was there a thought to maybe remove the Adderall?
Well, that was my suggestion. I actually, in part because of his recreational drug abuse in the past, I was contrary to initiating the Adderall and have cautioned about its use again, particularly in his case. However, the psychiatrist is driving that car at the moment. But given this new information and having researched the challenge more carefully, I think I'll be a little bit more insistent on trying to drop that dosing as quickly as possible.
Yeah. Just in case the listener doesn't know, because you keep using the word optimization, what does that mean to you?
Well, so as we age, optimization, we kind of reach our peak in our mid-20s, and after that, the the body starts to deteriorate, and until we can, in an absolute fashion, stop that deterioration, we can keep maintaining that youthful environment helps prevent the development of the adversarial environment that causes damage to our cells and ultimately the increase in the I call the welfare cells or the zombie cells, and that population that creates inflammation in the body and further deterioration and the aging process. That being said, optimization is basically the maintenance at youthful levels, at that optimum level where we're youthful, maintaining that environment, that physiologic environment in our bodies so that we potentially have less damage occurring and less need to consume our reserve of healthy cells and stem cells and that type of thing.
Cool. So essentially, there is no data to support that testosterone is linked to high blood pressure.
No, and studies actually, again, that just as an add-on, and studies on Adderall show that one in four of patients on long-term sympatheticomimetic medications for ADD or ADHD have been shown to develop accelerated cardiovascular disease and hypertension and those types of things. So I think the culprit in my case here is clear and needs to be addressed.
Cool. Well, guys, I hope that was helpful. I guess that's all we've got. I really just wanted to touch on that this time. So that being said, I hope you found it informational, educational, somewhat entertaining, and until next time.
Thanks for subscribing to Your Infinite Health. I'm Dr. Tripp.
And I'm Lene. Until next time, feel it, look it, and live it.